Okay. So today your class is on urine analysis. That is, we will see the normal and abnormal constituents of urine. Okay. What is urine? Excrete product. Any other ways we excrete our metabolites from our body? Sweat and stool. Okay. So how is urine produced? How is urine produced? Anyone? No? Stand. With the help of nephron. Okay. Sit down. So today we'll see both what are the normal constituents that can be found in a normal human being urine of a normal human being, and then we'll check what are the abnormal constituents. Okay. So urine analysis is the important laboratory test used to detect, diagnose and monitor various metabolic and renal disorders. So we analyze the urine to detect different diseases that are detectable by urine test. Okay, so there are certain tests which are used for screening, and certain are diagnostic tests based on which we can directly give medication. So urine test is for diagnosis also we can use it, and for monitoring metabolic diseases and renal disorders. Renal disorders like any diseases with respect to kidney or urinary tract infection. You have heard of it? Okay, UTI. So the bacteria, what happens? How does the bacteria enters in our urinary tract? One is retrograde pathway. So if you keep your perineum unclean, unhygienic, so via urethra, bacteria will reach the urinary bladder, or if you have stone in the bladder, then urine will be stagnant. It won't pass out easily. So then bacteria will start to multiply there. Then it can cause cystitis. Infection of urinary bladder inflammation is also known as cystitis. Then from bladder, if it get untreated, then it moves through urethra. Okay, ureter. It moves through ureter upwards to kidney. Then it infects the kidney. So this is the retrograde method of infection. Another is hematogenous. If you have infection in blood passes through kidney, nephrons, glomerulus. Then from there it can cause infections. So it helps to assess the functional status of kidney and systemic conditions such as diabetes, mellitus, jaundice, infections and dehydration. What happens in diabetes mellitus? You've heard of diabetes? What happens? What? And what is the main cause? What happens in pathophysiology of diabetes? What happens in diabetes? Blood sugar level rises above normal range. Okay. So what will happen if it is kept uncontrolled? Okay, blood sugar is uncontrolled for a longer period of time, then it will be affecting the kidneys. So blood sugar will be passing in the urine. What is the renal threshold? You have read in physiology renal threshold for glucose. See, above 180 milligram per dl. If blood sugar is above 180 milligram per dl in our blood, then our kidney is unable to reabsorb the sugar from the urine. So it gets passed in the urine. Then what happens in jaundice? Anyone? Yellowish discoloration of the sclera. Okay, so your urine also gets yellow discolored. Okay, high concentration, high colored urine. Then infection is there. Then dehydration. In dehydration, what happens? We drink less water in winter season. If you drink less water, then urine will be concentrated. Okay, then color will be yellowish, deep. So this is, what is this structure? Nephrons. And this part is, okay, via afferent arteriole the blood will come, then here it will be ultrafiltration will take place by podocytes, and if through efferent arteriole the blood will move out. So after ultrafiltration, the solute will come this way. This is PCT. This is what comes after PCT? Descending. This is descending loop, then ascending, and then distal. DCT, and then collecting duct. Okay. So slowly, the osmolarity of the filtered solute increases, and then again decreases, and then here it is excreted out. So physical examination in urine. Okay. So here volume of normally produced urine per day is 1 to 1.5 liter. In a normal human being, it will be 1 to 1.5 liter. When will we call it polyuria? If it is more than 3 liter per day. Okay, this happens in diabetes mellitus and diabetes insipidus. Okay, what is diabetes insipidus? Yeah. So huge amount of urine will be passed. Okay, this one. Then oliguria is less than 400 ml per day. And what? This can be found in shock patient. If a person have hemorrhage, RTA, road traffic accident, then there will be bleeding, blood loss. So blood volume will decrease. So amount of blood circulating through nephron will decrease. So pressure will decrease. So there will be decrease in urine volume. Then in renal failure, if there is kidney gets infection, then kidney won't be able to filter out. Ultrafiltration won't be proper, then the volume will decrease. Then in anuria is less than 100 ml. Due to infection, sudden infection or any insult that is put on the kidney, it can be due to drugs, nephrotoxic drugs, then kidney will stop functioning. Then color. What is the normal color of urine? Pale, a straw colored urine. Okay. This is due to Urochrome pigment. So dark colored urine is found in concentrated urine and red in hematuria. What is hematuria? Hematuria, present of RBC present of blood in urine. This is hematuria. Okay, in medical term we call it hematuria. And brown in color in jaundice. Then we see the appearance and turbidity. Normally urine is clear, but turbid if pus is present. Then what is pus? What type of cell are these pus? White blood cells. Okay, white blood cells. And crystals? Any diseases with respect to crystals? Which one? Ketone? No. Ketonuria. Ketonuria is passing of ketone bodies in urine. But crystals is uric acid. You heard of uric acid, gout. This forms crystals, oxalate crystals. Okay, we'll come to this. Then odor. Aromatically, normally. And ammonia samples. There is a pungent smell of urine that is due to ammonia. Okay. And then we can find fruity odor in ketosis. In diabetic ketoacidosis, there is ketone body in urine. So that gives a fruity smell. So we can find ketosis with fruity smell. There is Mousy odor, that is in diseases of phenylketonuria, we can find Mousy odor, specific characteristic odor. Then there is burnt sugar odor in maple syrup urine disease. In these diseases, metabolic diseases are phenylketonuria and maple syrup urine disease. In this, we will find specific smell to the urine. Then pH is, normal pH is 4.5 to 8. It is slightly acidic. Urine is slightly acidic. So normal chemical composition of urine, what will be normally present in urine? Will RBC be present in urine? Red blood cell? WBC? No, this won't be present. So normally we can find urine, urea, chlorine, sodium, potassium, creatinine, and other dissolved inorganic and organic compounds like proteins, hormones, and metabolites. So how will you collect urine? Any one of you have done urine test, or your relatives? No one has done. Okay. So there are two types of urine tests that we do. One is 24-hour urine sample. So for the whole 24 hour, You have to pass urine, patient have to pass urine. How they will collect? Every time they pass, they will collect in a small bowel or a closed container. Okay. Normally there is a flask like this much where we can collect. Or if the patient is admitted in bed in hospital, severely ill patient, we put a catheter, and then there is uro bag in which it gets collected over 24 hours. So such sample is collected for 24 hours for measuring total urine output for the day. This is used for determining the specific gravity of urine and for quantitative tests, estimation of different constituents of urine, like protein. For protein estimation we use, for sugar estimation we use, for creatine and calcium. Any protein, you can give example of any protein in our body, major protein. Albumin, you have heard of albumin? Okay. For albumin at 24 hour urine is used for albumin estimation. Okay. For routine urine examination, this is another type of collection, that is random collection. Random collection, or we can collect it, there is a fixed procedure for this collection. So after waking up in the morning, we collect the first sample. Okay, first sample. Why we collect it? Because it is concentrated, and throughout the night, if there is any bacteria that is present in your urinary tract, it will be getting time to proliferate. Okay, for bacterial culture, we can use this sample. So how it is collected? The midstream part of the first voided urine is used. So while passing urine, initial few drops or few amount of urine, we let it pass, and then in the midstream, we collect it directly into the container. Initial portion of the urine is discarded, while the midstream urine, around 50 ml, is collected in a dry glass or plastic bottle. Sterilized container must be used for collection of urine sample to be used for culture and antibiotic sensitivity test. Then wide mouth glass or plastic bottles with screw caps are used for urine collection. Glass bottles should be preferred. Urine collection containers must be clean and dry. This is the container, that is around 50 ml. So we collect here 50 ml of urine in the early morning. So while collection of urine, the patient should avoid urine directly into the container. If the container is to be collected for the purpose of bacteriological examination, firstly urethra, that is perineal part, must be cleared thoroughly. So the normal commensals bacteria that is normally present in your perineal area won't be contaminated. First, the urethra must be thoroughly washed, and then midstream urine should be collected in a sterilized bottle. So this bottle is found in seal packed. Okay, when the laboratory gives you for collection, they will give you in polythene seal packed. So before collection, you just open it, and you have to, before opening it, you have to wash your hand with soap. This is done to avoid external microbial contamination. In case of infants who do not cooperate in collection of urine in bottle, the urine sample can be collected in a disposable collection apparatus. A small container you can give, which is sterile, then the child will pee on it, and then you can use it for test. So here are different colors. This is red color, severely dehydrated, and this is, if you drink too much of water, it will be this. How will you preserve the urine? So for the first 1 hour, we don't need to preserve. This is the thing. When the urine sample is required, okay, to be kept for more than 1 hour for testing, then in normal laboratory, many people comes, or they collect it at home, then they comes, then they deposit it in a tray. So at around 10 or 12 am, the doctor come, and then they take it for estimation. So they have to keep it for more than 1 hour. So the protocol is, if you need more than 1 hour for analysis, then it should be refrigerated at 4 degrees centigrade. Or some preservative must be added to the urine sample to avoid microbial decomposition of organic constituents and cellular components. So if there is organic constituents like glucose, protein, ketone bodies in your urine, and you have given the sample, and if it is kept for more than 1 hour, then bacteria will decompose these things. So you won't get a correct estimation of the sample. So preservatives are used. And for these samples, these also prevent microbial growth in urine samples. So some recommended preservatives that we use are toluene, formaldehyde, thymol, chloroform, camphor, etc. Now we have to determine the specific gravity. Indicates the concentration ability of the kidney. Normal range is 1.015 to 1.025. Measured using urinometer. So what is the procedure? Put the urine in a cylinder, float urinometer, read the scale in the lower meniscus. Do you know what is meniscus? What is meniscus? So when you put a urine or any liquid in a glass tube, okay, what happens? Due to capillary action, or due to attraction force between the sample and the test tube, glass there will form like a bending, okay, bending or arc shaped structure. It can be like this or like this, upward like in, okay, yeah. So here we will see this is the meniscus. This is the meniscus. This is lower part. We have to take the lower part, and the correct way of reading is horizontal. And this is urinometer. Okay. So here we can get the actual reading. You can see. So the float urinometer, then read the scale at the lower meniscus, then correct for temperature difference. Add this part 0.01, 3 degree difference for calibration. So why do we need calibration? Anyone? Okay. You see this AC is at 16 degree. Okay, outside temperature is 27. So by now your body have already adjusted to 16 degree. If I bring a solution or a water, anything at 16 degree and put it here and ask you to put your hand, will you feel it cold or at normal temperature? Normal. But if you go outside, stand for 1 hour, then put your hand at same 16 degree water, then you will feel cold. So we need to calibrate both things, because different times you will give different report. So for calibration, if there for every 3 degree difference in temperature of the calibrated urinometer and the urine sample, we either add 0.01 or we subtract this one. So we will find lower specific gravity in diabetes insipidus and renal failure, and high specific gravity in diabetes and dehydration. So determination, how will we do? Specific gravity at a constant temperature is the ratio of weight of a volume of urine to weight of the same volume of distilled water. Specific gravity of urine is determined by an instrument or apparatus called urinometer. This is the urinometer, and the formula is specific gravity of urine is weight of 1 ml of urine by weight of 1 ml of distilled water. So here we check the temperature correction of the observed specific gravity. If the temperature of urine is higher than the temperature of calibration of urinometer, let's say urinometer is at the temperature of 15 degree, calibrated at 15 degree standard, then and the temperature of urine that is collected or kept as a sample, that is 27 degree. So we will deduct it, that is 12 degree centigrade. So for correction below, we will multiply this one, because for every 3 degree there is this much 0.01 change. So we will divide this 12 difference 12 by 3. So there will be 4. Okay. So 4 times 0.01 will be this much. So what we have observed in this, you will get a value here. With this, you will add this corrected calibration. Okay, then you will get the correct specific gravity. Similarly, if the urine is less temperature than the calibration of urinometer, that is, let's say your calibration is at 15 degree and urine is at lower temperature, that is 12 degree. So difference is 3. So here again we will multiply this by the difference. Okay, so the difference, we will divide difference by the change of temperature, that is 3. 3 times 0.01 will be 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 and we will multiply it by 0.01. So here calibration will come, then we will correct it. So this will be the standard. This one is observed and this one is corrected. So we will get the final answer. So now sediment formation and deposits. Do you know what is centrifugation process? Yeah, in order to differentiate the different components. Okay, sit. So by centrifugation, the urine sediments is examined microscopically. So they form different layers, different composition. They clump together and form different layers depending on densities. So what can we find normally? Epithelial cells can be found from the tract, and then RBC, WBCs are found. So normally RBC, WBCs are not found in normal samples, but some physiological condition, like if you do a strenuous exercise, little amount of RBC can pass through glomerulus. In hypertension patient, due to high blood pressure, few amount of RBCs can pass through the kidney. Then we can get crystals like oxalate crystals, phosphate crystals. If your body is unable to metabolize the products nicely, or there is error in metabolism, then oxalate and phosphate will be passed in urine. Then there will be casts like hyaline cast, granular cast and cellular cast. We will read about this one. Bacteria or yeast can be found if it is present in urinary tract. The presence of this help in diagnose the urinary, renal and urinary pathology. So the cells can be found like isomorphic RBC, normal RBC, then dysmorphic RBC, then WBCs, reticulocytes and squamous cells. Casts are like hyaline cast, fine granular cast, WBC cast and RBC cast. See, these are small RBCs. They clump together. Then crystals like calcium oxalate crystals, uric acid crystals, struvite crystals, cystine crystals. What will happen if these crystals get accumulated for a long period of time? They will join together to form a stone. So what are urinary casts? These casts. Urinary casts are tiny tubular shaped particles found in urine that formed in kidney tubules and are made of various substances like protein, red blood cell and WBC. The presence of urinary casts signifies a problem with the kidney, as they are formed in the kidney's tubule and indicate a range of conditions like kidney disease, infection or injury. Like here you can see, hyaline cast is non-specific. It can be found during exercise also, so it can be specific for any diagnosis. In microscopy, you can see hyaline cast, you can diagnose anything, not specific. Granular or muddy brown casts can be seen. After finding this, you can get conclusion like acute tubular necrosis has happened. Then similarly, fatty cast for nephrotic syndrome, you can find it. Then WBC will be there if there is intestinal nephritis or pyelonephritis, infection of the kidney. Chronic infection of the kidney, pus will be formed in the kidney, then it will be passed in urine. So WBC can be found in urine. Then RBC cast will be found in glomerular nephritis and vascular diseases. The vascular diseases like Goodpaster syndrome, SLE, post-streptococcal glomerular nephritis, etc. Then epithelial cells can be normally found from the urinary tract, it can be found in urine. Then there is Waxy cast. Waxy cast can be found in acute kidney injury and end-stage renal diseases. If the kidney gets destroyed after prolonged amount of, if there is diabetes, uncontrolled diabetes for huge amount of time, then it will go to chronic kidney disease. Okay, after chronic kidney disease, the kidney gets destroyed. Then we can call it end-stage renal disease. After which, what we will do if kidney gets damaged to remove this dialysis. Now the chemical examination of urine. In chemical examination, what we detect? This chemical examination we will be doing in our practical classes from next day onwards. So we can detect glucose, ketone bodies, proteins, bile salts, and pigments. For protein detection, here we do heat and acetic acid test. We take the sample of urine and we heat it. If the protein is there, what will happen if protein is heated at higher temperature? It gets denatured. So it will probably precipitate. On heating more, what will happen? It gets dissolved. So prevent this dissolving property, we add acetic acid. Little acidity will be there, then this protein won't be dissolved. Then there is glucose. For glucose we do Benedict test. We will add Benedict reagent to the urine sample and we will perform the test, and then depending on the concentration of glucose, it will show different color. Okay. As the concentration increases, it will move to green, yellow, orange, red. Then for ketone bodies, we will do Rothera test in the reagent. After mixing the chemicals, a beautiful purple coloring will be formed in the junction of the two liquid reagents. Then for bile salt, we do Hayes sulfur test, and for bile pigment, we do Pochet test. For qualitative test for organic constituents of normal urine. So for urea detection, we do urease test and we get a ammonia smell. For uric acid test, we do phosphotungstic acid test, in which blue color will be shown. For creatine, we will do Jeff reaction, in which orange-red color will be found. And for hippuric acid test, on heating with HCl crystals, we will separate. For ammonia detection, it is detected by smell, ammonia smell, or with litmus paper. So in summary, we can do urine analysis. Okay, urine analysis include how we analyze the urine, both physically, by visually. We can visualize WBC, past cells, white color turbidity and all, high colored urine. Then chemically by those tests, and then microscopic examination. We see the cast, the WBC, RBC, all this. Then it provides vital diagnostic information about kidney function test. How your kidney is functioning, we can understand by this, doing this test. And for hydration, for metabolic diseases like phenylketonuria, we get odor, musty odor, burnt sugar odor, these things. And for other systemic diseases like diabetes, we can find sugar in urine. So interpretation must be correlated clinically with history and biochemical findings. What is the significance of taking history? Do you know what is history taking? You ask the patient, okay, what is your name, from where you have come, okay, now how you have come here, what is your family economic condition, what have you eaten last day, or what, do you have any diseases, are you consuming any drugs for any diseases, is there similar history in your family? So this sort of history we have to take. So what is the significance of taking history and biochemical findings? Because biochemical findings in lab, already you are detecting something. So why do you need to ask it again? If you are getting something that is permanent, you are confirmed that is RBC is there, uric acid is there, then why do you need to ask the patient again? For mismatch. But you are getting the sample, right? Okay, mismatch is one thing. Any other? Any other condition? How it happened? Okay. Any other? Okay, let's say you are doing test for creatine or uric acid. Okay, now there is a bodybuilder. He is taking creatine for body, whey powder and those things. So already he is consuming extra amount of creatine. So it will be normally raised in his body. So in blood, in urine sugar, urine test, or in blood serum, which normally we do, there will be raised level of creatine. So what will you interpret? You will interpret it as a kidney disease. His kidney is gone. But if you correlate with his history, then it can be normal. Like in some patients who is taking calcium tablet, vitamin D3 chronically, okay, without consulting any doctor. So they can also have high calcium in their blood. Similarly, if you take chicken, fish, dal and all those things, alcohol, so this will affect your urine samples. So history is most important for this correlative findings. This much is for today. Okay.